What is valvular atrial fibrillation versus non-valvular atrial fibrillation? So this has to do with protecting people from the small but very real risk of clots and stroke with atrial fibrillation. Remember, atrial fibrillation causes two main problems. One is it can make your heart speed up and cause symptoms of rapid heart rates, which that by itself is never directly dangerous or life-threatening because it'll never make your heart go at a life-threatening speed. So that we're just treating for symptoms. But also remember, the most dangerous thing that can happen to you with atrial fibrillation is that a tiny clot forms inside your heart during an episode, and this could break loose, float out of your heart, float up to your brain, cut off blood supply to your brain, and cause a stroke. And nobody wants to have a stroke. And so therefore, people are usually placed on specific blood thinners to reduce their risk, not to zero, but close, less than 1% risk. So if you're on a specific blood thinner for atrial fibrillation, it should mostly reduce your risk from clots and strokes from AFib to less than 1%, which, as we said, does not mean you cannot have a stroke on a blood thinner for AFib. It just means you probably won't have a stroke from a blood clot from AFib. You could still have a stroke the standard way, which is live long enough to form cholesterol blockages directly in your brain vessels. That has nothing to do with AFib, has more to do with your diet, high cholesterol, smoking, diabetes, high blood pressure, blah, blah, blah. But now if we protect you from clots and strokes with AFib, you have one way of having a stroke instead of two ways of having a stroke. But talking about what blood thinner to use. So for 50 years, up until about 13 years ago, we used a blood thinner called Warfarin or Coumadin. And this is what some people affectionately refer to as rat poison, which is because it's kind of what they use in rat poison. What it does is it thins your blood, and in the cases of rats, it thins the blood enough that they spontaneously bleed and they hemorrhage and they can die. So it's just a powerful blood thinner. We used that for 50 years, and it's a tried and true agent. It does work, but it's just very difficult to take Warfarin or Coumadin because it makes you form less clotting factors in your body, and it inhibits that or blocks you forming clotting factors to thin your blood. But there's just so many things that affect Coumadin. Your diet can affect it, how much green leafy vegetables, how much vitamin K. So if you're on the Warfarin, you have to have a very regimented diet that doesn't change very much. And then we have to adjust the dose of the Warfarin constantly until we're blocking whatever amounts of clotting factors that you make. But if you change your diet even a little bit week by week, then we either have to go up on the Warfarin to block more clotting factors or go back on it because you're getting too much Coumadin and therefore your blood's too thin because it's blocking too much clotting factors. And also medicines, so many medicines interact with it. So traditionally, when people were on that, they always had to do their blood checks frequently and constantly adjust their dose. And some people, they could have a pretty stable diet and maybe get checked once a month with minor adjustments. But other people might have to be checked weekly and constantly adjusting their dose. And it was just very difficult sometimes to keep people in the proper range because you have to have your blood at least twice as thin as normal for clots not to form. So more recently, in the late 2000s, we came out with some drugs that block certain clotting factors directly, and they aren't affected by diet. They're not affected by other medications. They just kind of work for your age and weight. They just kind of work. And so these have become more standard medicines. People with valvular atrial fibrillation versus non-valvular atrial fibrillation is defined as people who have atrial fibrillation in the setting of a valve problem. So if you have valvular atrial fibrillation, specifically what it means is you have atrial fibrillation in the setting of a mitral valve problem. So your mitral valve, remember, you have 4 chambers in the heart. You have blood that's meant to go in one direction through the chambers. And so you have one-way valves that let blood enter the next chamber and then they snap shut. So the chamber where AFib forms, the cells form, it's got a valve called the mitral valve that blood exits that chamber into the next chamber. And so if your mitral valve is a mechanical valve, because you've had, valve problems where your valve got too narrow or stiff where it wasn't opening up properly to let blood go into the next chamber, or it leaked severely. So when it closed, it was leaking blood back into the previous chamber, and you had a valve replacement and you have a mechanical valve, that would be considered to be valvular atrial fibrillation. Or if your valve was very thick and not opening up properly, very stiff, we call that stenosis. If you have moderate or severe mitral stenosis, we also would label you as valvular atrial fibrillation. And why is this important? Because in people who have mitral valve issues, either a mechanical mitral valve or moderate to severe mitral stenosis without a valve change, we know that blood clots can form in that chamber from AFib, not just they can form anywhere, but it can also form on the valve itself. And so therefore, the newer agents haven't yet been proven to be able to reduce clots from forming as well as warfarin or Coumadin in these select patients. Fortunately, most people don't have mitral valve issues or mechanical mitral valve, and so therefore they would be classified as non-valvular atrial fibrillation. And in this group, the newer agents have been proven to work just as well, if not possibly better than warfarin, because the blood doesn't vary all the time in terms of how thin it is, and they're much easier to take. And so most people have non-valvular atrial fibrillation and can be on the newer drugs, which are just easier to take. But if you do have mitral valve stenosis, significant, moderate, or severe, or you have a mechanical mitral valve, then we would classify you as valvular atrial fibrillation. And technically speaking, the studies have shown that because clots can form even on the valve itself, as well as in other parts of that chamber, that warfarin is probably better for you in terms of preventing a clot and stroke than these newer drugs, these newer oral anticoagulant agents.